Unveiling the spectrum of vitamin B12 deficiency. 12 signs and their impact on health. Vitamin B12, a water-soluble vitamin, plays a vital role in various physiological processes within the body, including red blood cell formation, nerve function, and DNA synthesis. Despite its importance, vitamin B12 deficiency is a prevalent condition that can manifest with a myriad of signs and symptoms affecting multiple organ systems. This review aims to elucidate the signs and symptoms of vitamin B12 deficiency and their implications for overall health. Through an analysis of scientific literature, epidemiological studies, and clinical observations, this paper seeks to raise awareness about the silent epidemic of vitamin B12 deficiency and highlight the importance of timely diagnosis and treatment. Overview of vitamin B12 and its essential role in human health. Prevalence of vitamin B12 deficiency globally. Objectives of the review: identifying signs of vitamin B12 deficiency and their impact on health. The role of vitamin B12 in the body. Functions of vitamin B12 in DNA synthesis, red blood cell production, and neurological health. Regulation of homocysteine metabolism and methylation reactions by vitamin B12. Influence of vitamin B12 on cognitive function, mood regulation, and cardiovascular health. Common signs and symptoms of vitamin B12 deficiency. Fatigue and weakness. Understanding the role of vitamin B12 in energy metabolism and red blood cell production. Anemia and pallor. Exploring the effects of vitamin B12 deficiency on hemoglobin synthesis and erythropoiesis. Neurological symptoms. Investigating the link between vitamin B12 deficiency and peripheral neuropathy, tingling sensations, and cognitive impairment. Glossitis and mouth ulcers. Assessing the impact of vitamin B12 deficiency on oral health and mucosal integrity. Difficulty concentrating and memory problems. Examining the relationship between vitamin B12 deficiency and cognitive decline. Depression and mood disturbances. Understanding the association between vitamin B12 deficiency and mood disorders. Dizziness and lightheadedness. Exploring the effects of vitamin B12 deficiency on cardiovascular function and orthostatic hypotension. Shortness of breath and palpitations. Investigating the link between vitamin B12 deficiency and cardiovascular symptoms. Vision changes and optic neuropathy. Assessing the impact of vitamin B12 deficiency on visual acuity and retinal health. Muscle weakness and poor coordination. Examining the relationship between vitamin B12 deficiency and neuromuscular dysfunction. Digestive symptoms. Exploring the effects of vitamin B12 deficiency on gastrointestinal function and malabsorption. Paresthesia and numbness. Investigating the link between vitamin B12 deficiency and sensory neuropathies. Risk factors for vitamin B12 deficiency. Inadequate dietary intake of vitamin B12, rich foods. Assessing the prevalence of low vitamin B12 consumption in vegetarian and vegan diets. Malabsorption disorders and gastrointestinal conditions. Understanding the impact of pernicious anemia, celiac disease, and gastric bypass surgery on vitamin B12 absorption. Age-related changes in vitamin B12 metabolism. Assessing the risk of deficiency in older adults due to decreased intrinsic factor production. Medications and drug interactions. Identifying medications that may interfere with vitamin B12 absorption and utilization. Diagnostic evaluation and treatment strategies. Laboratory tests for assessing vitamin B12 status, serum vitamin B12 levels, methylmalonic acid, MMA, and homocysteine levels. Recommended daily intake of vitamin B12, dietary sources, supplementation guidelines, and absorption considerations. Pharmacological interventions for correcting vitamin B12 deficiency, oral supplements, intramuscular injections, and nasal sprays. Lifestyle modifications to enhance vitamin B12 absorption and utilization, dietary modifications, stress reduction techniques, and smoking cessation. Conclusion. Summary of key findings and implications for clinical practice. Importance of early detection and intervention in preventing vitamin B12 deficiency-related complications. Future research directions and unanswered questions in the field of vitamin B12 research. By recognizing the signs and symptoms of vitamin B12 deficiency and addressing underlying risk factors, healthcare providers can play a crucial role in improving patient outcomes and promoting overall health and well-being.